My name is Dr. Amy O'Neil. I'm a cardiologist at McLaren Cardiovascular Institute. First off, it's a very rigorous field. It requires a lot of sacrifice to get to the point of being a physician. You sacrifice about 7 to 10 years of your life, of your 20s, to your schooling and postgraduate education, and it's a lot of time. So I'd recommend as early as high school starting to look at volunteering at different medical facilities, whether that's an urgent care or an ER or doctor's office. Also looking into shadowing physicians, so you start to really see what the medical field is like. As far as medical students are looking into what is required to apply to medical school and things like that, there's a couple good websites. There's the AAMC.org, which is the American Association of Medical Colleges, and then AMSA, the American Medical School Association. So I did volunteering at different hospitals and things like that, and also on campus, like the dentist school and different medical facilities. There are not enough residency spots for all the medical students that graduate every year. There are more and more medical schools that are opening, but not enough postgraduate training spots for them. So every year there will be medical students who won't have a residency spot. There just are not enough to go around. A lot of the cardiology advice is about prevention. So the simple things like diet and the proper foods to eat and exercise, and people don't always realize how, even if you don't add anything to food, there's a lot of food out there that has a lot of additives, and so understanding what exactly is healthy and what's a healthy diet and healthy amount of food, and how that affects how you feel and how it affects your overall health. In medical school, you learn a lot of the hard sciences, and you learn kind of algorithms of what to do, how to treat patients. But when you get into practice, you realize it's also as much of an art as it is science, and not every patient falls into one type of algorithm or plan. So it's very, there's a lot of art and really critical thinking aspect to it. You're an advocate for the patient and for their health, but you're also a teacher in a lot of ways, teaching them how to prevent disease and how to improve their quality of life. The messages with COVID-19 can present challenges, especially when there's skepticism regarding the severity of COVID-19 and skepticism around the vaccine, and certainly that can prolong the burden on the hospitals and the healthcare system. But I think it presents a good opportunity to educate the patients and to really explain from a scientific basis, the importance of getting the vaccine and dispelling any kind of myths. So I find that pretty easy. I find that pretty enjoyable to help them understand their health, and they seem to be very appreciative of the education and increasing that knowledge and being able to understand that they have a lot more power to improve their health and their quality of life. So I think is my impact, I think, like I said, being an advocate for the patients and really teaching them, educating them, and helping them to achieve their goals, understanding what their goals are, and helping improve their quality of life.